Hey everyone, welcome back to Autism Uprooted with BioNexus Health. Today, I'd like to briefly talk about camel milk, the harmful effects that can be seen when it's added in indiscriminately, not based on evidence, labs, and medical advice, not based on a protocol that is given to you by a proper licensed medical practitioner. So, it could be a nutritionist, could be an herbalist, it can be your pediatrician, it can be an integrative medicine doctor, but someone medically qualified, someone who understands what is PANS, what is PANDAS, what is an overactive immune system. So let's take a deep dive, however briefly, and I will share some lab results with you as well, just to kind of, illustrate what I'm trying to say.
Welcome to the BioNexus Health podcast with Dr. Jody A. Dashel, who holds a PhD in integrative medicine, is board certified in integrative pediatrics, an internationally recognized pioneering clinician, and author. And now here's your host of BioNexus Health podcast, Dr. Jody A. Dashel.
Let's proceed. And what I'm going to do, I'm going to share some labs with you, and I will narrate what happened with this child. So I'm going to share labs with you of only one child, and mom got information online about camel milk, and the information was I guess half-baked, because unless you have a practitioner, like I mentioned earlier, that understands the connections and the physiology, neurology, neurobiology, the neuroimmune endocrine connections in children with autism that may also have PANS, PANDAS, biotoxin illness, mold exposure, Lyme disease, underlying co-infections, leaky gut leading to leaky brain. So this is a lot for a body to deal with. And understanding autoimmunity is very important. I know that there is a lot of misinformation out there about camel milk. Almost every conference I speak at, people ask me about my proprietary protocol for using camel milk at the right time so that it is actually beneficial. Because, come on, we know that camel milk is a superfood. It's, it is very nutritious, and the nanobodies can be beneficial when added at the right time. Right? Now, what is nanobodies? Nanobodies are antibodies that exist in camel milk that are 1/10 the size of human antibodies, right? So they are nice and small, and they have a lot of beneficial effects on the immune system. And the goal is that if the immune system is supported, then you will see certain improvements, right? Does it work for some children? Sure. Is it harmful to others when used indiscriminately and without proper investigation, if there are any underlying issues? Absolutely. I had that issue with my son as well. I was given completely half-baked, non-qualified information. And as you know, desperate autism moms will try anything after reasonable research. And I was like, hey, it's just milk. But the information that I was given was by a completely non-medical person, a mom, and we know that autism moms are very highly respected for their research abilities. So that's the reason why I decided to give it a try. It took about a year to help my son come back with his completely destroyed gut health. And when gut health is destroyed, the autoimmunity PANS, PANDAS gets worse. And why did this happen? because I followed the advice and we did raw camel milk, and that was a humongous mistake. That's what prompted me when I was trying to help my son recover, get better, from this year-long PANS flare. Oh my gosh, it was just, what a nightmare. Now, those of you parents, that are familiar with having a PANS flare, usually will last 4 to 6 weeks. Imagine a year long, because, taking the wrong thing at the wrong time, that's what happens. Because there's a lot of irresponsible information out there. So it is up to you as a parent to filter out the riffraff and understand what's really happening, right? Okay, so let's go. Autoimmunity. What is autoimmunity? Well, PANDAS is an autoimmune condition. Autoimmunity means your immune system is overactive to the point where it is attacking self. So it's friendly fire. In PANDAS, we know that this friendly fire is targeted where? To the brain, to the basal ganglia in the brain. So you can have a lot of stimming, eye blinking, vocal tics, and the motor tics are also mistakenly called as stims or stimming in children on the spectrum. Okay, children who actually have PANS. I mean, in my practice, 100% of children on the spectrum that I see, because of the nature of my practice, they come to me, they also have PANDAS. So we see a tremendous relief in the stimming, the hand flapping, the eye blinking, the facial grimacing, the obsessive compulsions that are seen. So we see relief from that. But you know what? Another thing that I'm asked to speak about at conferences a lot is, what is the right order of treatment? And that is absolutely crucial. For those of you who are familiar with the BioNexus protocol, it is a step-by-step process. There are many steps involved, and we slowly progress based on evidence. We run labs, we see what's going on with the child, and we proceed with a completely customized protocol. The same needs to be done with any thing that affects the immune system. I have spoken about, shying away or completely avoiding immune boosters for children on the spectrum that have PANDAS. Now, if you are a parent who hasn't run labs on your child, you don't know if there are if your child has PANS or PANDAS issues or biotoxin illness. This is all friendly fire. Biotoxin illness is friendly fire or autoinflammatory issues from your innate immune system. Your innate immune system is attacking the body, creating incessant inflammation. And PANS is your adaptive immune system, where anti-neuronal, meaning neurons in the brain, anti-neuronal antibodies are being sent by your immune system to attack the basal ganglia in the brain. So this is something you can research yourself to find out what it is. For those of you who are BioNexus clients, we always email all the labs to you right after your labs review. Please take a moment to actually understand what's going on with your child. Autoimmunity is not a minor thing. Is it better than ASD? Of course, because with herbal medicine, autoimmunity can be handled. So, if your child has been either misdiagnosed with autism or actually has, a small amount of true autism and a large amount of underlying issues, PANDAS, biotoxin illness, then we're looking at obviously a much better scenario, right? Okay, so what I'm going to do is, like I said, I'm going to share some labs, but just some background first. So this mom, this family, I just started with them a couple months back, and then, we sent the labs out. And what happened was the labs came back, we did a lab review, absolutely severe issues going on with the child. I will explain when I share. And then, mom revealed to me that she found information about raw camel milk in a book about autism. I'm not going to name names, obviously. And then, in online support groups and what have you. And it was, the information is incomplete, like I said, unless it comes from a licensed medical professional, right? Again, it can be a nutritionist, it can be an herbalist, it can be your physical therapist, your OT, but someone who is licensed and knows a little bit about the body and the immune system and the gut and what is the, what can be the debilitating effects of adding the wrong thing at the wrong time, right? Something that involves the immune system and antibodies and autoimmunity. So that is the most important thing. You need to get information from qualified people. Hats off and all due credit to those amazing autism moms like myself out there, sharing their experiences and positive experiences with anything, right? It could be any dietary supplement from camel milk to vitamin C, but remember, that is their individual experience. Let me repeat, there are no miracle cures that can, overnight give you speech and what have you. It just doesn't exist. Anyways, let me share the labs with you, right? Bear with me. This is the first page, right? So this child has a pretty heavy C. diff infection and also enterohemorrhagic E. coli. So, these are nothing to mess around with. And this is going on in his gut. In spite of being on raw camel milk for, months, unfortunately, very unfortunately. But, so this is page 1. Now I'm going to share with you the next page. So again, 1 second. There is beneficial bacteria in raw milk, etc. But look at the gut. There is a pretty heavy duty imbalance. There is a lot of beneficial bacteria that are seriously low. I mean, minimum is 8. There's only a 2. Minimum is 1.9 E5. There's only 3.1 E3. So there is a huge deficiency of beneficial bacteria. Actually, I just remembered this child has been on raw camel milk 7 months. Okay. So as you can see, 0 benefit. Now let's see. There was actually harm being done. So let me share the next page of the lab. So now we are seeing overgrowth. So there is Morganella. Morganella is extremely high. It should be less than 1 E3. It's 3.3 E5. Okay, and what is the number 1 trigger for PANDAS? Strep. Look at how high the strep is, right? Strep, staph, Staph aureus, Morganella. Morganella is commonly seen when there is severely chronic Lyme disease and co-infections, tick-borne infections. That's when I will see Morganella positive in a child's lab. All right, now we have, Citrobacter frondi. These are both inflammatory, brain inflammation and autoimmune related bacteria, of course, gut inflammation as well. You see where it says family, that is SIBO, methane producing bacteria, small intestinal bacterial infection that is almost high. All right, 5.65 E7 and 3.3 E8 would be high, but that is too close for comfort. So there is SIBO. So the small intestine is involved. The large intestine is compromised. The good bacteria, many are low. There is C. diff. So what was the benefit of camel milk? What? Nothing. Now let's look at the harm done. All right, I'm going to go to the next page. As you can see, immune response is hyper. That's what did I explain about autoimmunity a bit earlier, right? This is an overly boosted immune system. This child is gluten-free, has been gluten-free for 3 years, strictly gluten-free for 3 years, okay? Because there is a, in AR's family, there is a family history of celiac. So with autism, mom has been like super careful about gluten-free. But what do you see here? Anti-gliadin is high, very high. The eosinophil activation protein is also high, which is gut inflammation. Okay. And lastly, let me see if I can move this over here. Yeah, now you can see the last thing on the screen is zonulin, right? So zonulin is 460. It needs to be less than 100 in children on the spectrum. I know that the reference range says less than 175, but I like to see less than 100. So this way we can repair the gut. Okay. So once again, the amount of antibodies this poor little kid has, by the way, AR is 5.5 years old, 3 years completely gluten-free, right? So overactive immune system, classic PANDAS, anti-gluten antibodies, that is also autoimmunity. Now, why is he having autoimmunity to gluten? You know, the lectin, gluten is the most well-known lectin. Now, lectin inflammatory pathway in the body can cause a lot of inflammation, systemic, not just gut, but the brain and systemically. So that is why children who are exposed to mold, it is very important to be on a gluten-free diet because of this inflammatory pathway, right? So what has happened here? When you are immune boosting, like I said, camel milk, especially raw camel milk, even the flash pasteurized one, I mean, overall camel milk, at this stage for this child, the worst thing you can possibly do is to go for raw camel milk or any kind of camel milk, but the worst thing would be raw. Okay, that's what was done. And you can see that there is, in spite of not eating gluten, there are anti-gluten antibodies. You know, Dr. Vojdani has done a lot of work with this, you know, and there are other amazing practitioners that have worked on the similarities or cross-reactivity with gluten. So there are many foods, I think there are 14, if I'm not mistaken, according to research, that an overactive, weak, and confused immune system like this one is going to erroneously identify as gluten and become even more autoimmune, causing further inflammation and damage to that particular person's body. So, some of that being rice, chocolate, tea, coffee. So these are some of the corn would be another one. So these are some of the common substitutes for gluten that are used by families, isn't it? Rice, one, for example, and unfortunately, even the tiniest of resemblance in the protein structure, in the amino, I'm sorry, just one moment. The phone's ringing. Let me turn that off. Sorry about that. That was actually something important. So I'm going to wrap this up real quick. I have to give them a call back, but sorry about that. But anyways, right. So what is happening here is that even the tiniest of similarities in the protein structure of wheat and rice in, a couple amino acids even, that can be a trigger for autoimmunity to an immune system that is already weak and confused and overactive. So I hope you understand that. Please, even though camel milk looks like, hey, it's just milk, it's a superfood, please consult with me or any other qualified licensed healthcare practitioner before you start camel milk for its so-called proclaimed benefits with language, communication, whatnot. So the question will be, when do I add camel milk? Well, as you know, BioNexus has done a lot of research. We have an international multi-center study going on right now. We have patients from 35 different countries participating in the study on camel milk. So we will be releasing the results soon. I will be speaking on the immune modulatory effects of camel milk at one of my soon to come future conferences. So I'll be happy to share the PowerPoint, share my findings in one of my podcasts, because I think it's very important. There is a lot of misinformation out there, and it's important to treat with the right thing at the right time in the right order of priority. Now, poor AR, it's going to take us at least a year to, use herbal medicine and kill off all the infections and to modulate the immune system. Remember, when the immune system is boosted to this high levels, you don't need any further boosters. So, stay away from all of the echinacea and astragalus and elderberries. And we do not need immune boosting. What do we need? We need immune modulation. So there are fantastic herbals. There is a specific diet which can be followed. There are minerals which can be used depending on your lab. I believe in complete customization for maximum benefit. That is how it needs to be approached. Immune modulation, not immune boosting. So please review your child's labs and please make informed decisions. Any questions about adding camel milk? I'm here for you. Most patients, most parents will ask me, is it the right time to add? So I'm happy to give you a complete bio-individualized explanation based on your child's labs, that when is that beneficial? BioNexus has recently released absolutely fantastic speech blend, and also a neurological support essential oil for scalp massage, which supports the speech blend. So there are herbals which can help with repair. When you have autoimmune issues, what do? Right? First, you identify the triggers for PANS, PANDAS, biotoxin illness. Then you support the body while we eliminate the triggers at the same time. So, if it is toxins, we detox. If it is infections, we kill them, all with 100% plant-based protocol. The next step, once the labs come back clear or mostly clear, then we can go in with repair. We have to repair the damage that was done by the toxins, the infections, the underlying issues. After repair, we look at labs that, yes, things are moving in the right direction. Very scientific, evidence-based approach is what is required if you wish to see a true recovery that is not a flash in the pan. It is not a Band-Aid. When you treat properly, you will see communication, speech, language, cognitive gains, fine motor, gross motor, spatial awareness, sensory, picky eaters are no longer picky eaters. I mean, imagine, right? If you have all of these infections in your gut, the colon, the stomach, the small intestine, how would you not be a picky eater? Our kids have minimum words. Many are nonverbal. They cannot explain to you that, when you give me that apple, it burns me inside. So I'm not going to eat it. And if you're trying to force me, I'm going to have this massive tantrum. And then slowly, a lot of foods are eliminated from the diet because, as you saw in the labs, there is a lot of difficulties that our children face and they are not able to verbalize. So what is the final stage of the BioNexus protocol is what? It's fantastic because it is regeneration. Okay, we use biodynamic, organic, herbal formulas with evidence-based, proven herbals that help with neuronal regrowth, regeneration, regenerating the lining of your gut, mucosa, and so many other physiological and biochemical rebalancing that happens in the body. We can do it. We can do it with 100% plant-based. That is what the speech blend is. That is what the NS2 blend is. So it can be achieved without any invasive techniques, methods, treatments available out there. You don't need anything invasive. That's been my experience, more than a decade with hundreds of children that have been recovered. And most parents that come to me prefer to do the all-natural, plant-based, non-invasive approach. So please be careful what add-on treatments you are doing. Please let me know. Just send a message through the online patient portal. So my clinical staff can guide you that, don't add something like camel milk based on, online information. Okay. Oh, you know what? I'm going to share some personal information with you as well regarding camel milk so that, it's not all gloom and doom, obviously. Remember, all I'm saying is, be careful and due diligence and understand what is what before you just go for, the next best thing or the next advertised best thing. So now, once I had about a year that it took for Brian to get better. So I researched, I contacted Professor Yagil, Professor Abdul, these are all stalwarts in the world of camel milk. Professor Yagil was in Israel, Professor Abdul is in the Middle East, and with PhDs, with amazing research backgrounds, that understand the immune system, the human immune system, the camelid immune system, as well as the actual properties of the camel milk. So there was a lot of research that went into this, a couple of years. And then, we tried herbals for immune modulation and finally arrived as to when would be the most opportune time to start camel milk and how, and what herbs to use to minimize any kind of detrimental effects. Even when done at the right time, you can have a heavy duty die-off response. Okay. So the good news is, of course, we were able to add camel milk back in because, calcium, superfood benefits, no doubt about that. So we started with the flash pasteurized, slowly built up to the raw, and it's been years. It's been, I would say, more than 10 years, not more than 10, a little bit less than 10 years that we were finally able to be steady and stable because immune modulation had occurred, labs came back fine, the PANDAS symptoms were completely in remission, Lyme co-infections were in remission, autism was gone. So that's when, I felt comfortable adding camel milk. Sorry, the phone keeps ringing, but, so to date, I consume camel milk, as does Brian, right? And again, we can talk more at your appointments. I'll be doing another podcast about camel milk and its beneficial properties, when to add it in, etc. But just yesterday, I had this meeting with the mother of the child whose labs I shared, and it was just really an eye-opening meeting for mom and dad as well as for myself. So I just wanted to share, with other parents who might be watching. All right, so that brings us to the end of today's podcast. Thank you for joining me. Be well, and I will see you next time. Namaste.
Thank you for joining Master Herbalist Dr. Jody A. Dashel, Director of the BioNexus Health Clinic and BioNexus Herbals, on the BioNexus Health Podcast, where we explore and share information and stories about recovering and healing from chronic and environmental illnesses such as mold biotoxin illness, Lyme disease, autism spectrum disorder, fatigue, Crohn's and colitis, mast cell activation syndrome, PANDAS, and more. Please help us grow our message by subscribing to our podcast channel and sharing the podcast on your social networks. For more information, visit bionexushealth.com.
Information within this video, audio, or text, collectively known as the podcast, has not been reviewed by the FDA. Nothing within the podcast is intended as or should be construed as medical advice. Information is for general informational and educational purposes only. Consumers of the podcast should consult with their healthcare practitioners for medical recommendations. Seek the advice of a qualified healthcare provider. Do not disregard the advice of a healthcare provider based on any information from the podcast. The information within the podcast may contain information concerning dietary supplements or over-the-counter products that are not drugs. Our dietary supplement products are not intended for use as a means to cure, treat, prevent, diagnose, or mitigate any disease or other medical or abnormal condition.